ರಿವ್ಯೂನೇ ಬರ್ತಾ ಇಲ್ಲ ಯಾಕೆ?
ಮತ್ತೆ ಕ್ವಾರ್ಟರ್ಲಿ ಮತ್ತೆ 2 ಡೇಸ್ಗೆ ನಾವು ಕಟ್ ಮಾಡಬೇಕು ಈಗ.
नहीं सर,
कैसा चल रहा है?
अभी लाइव नहीं है।
कब लाइव होगा? 4 o'clock?
3 बजे
बात कर सकते कैसे?
यहाँ से।
हम बात कर सकते ना?
नहीं, यूट्यूब से तो नहीं है।
हम आपस में बात कर सकते?
हाँ, दिस विल बी ओनली म्यूचुअल। नो, ये नहीं जाएगा।
ಅಲ್ಲ 2 ಇಯರ್ಸ್ಗೆ ಇಷ್ಟು ಅಮೌಂಟ್ ಅಂತ ಇದೆ ಸರ್. ನೀವು ಇವಾಗ ಬೇಸ್ ಮಾಡಿ 2 ಇಯರ್ಸ್ನ ಡಿವೈಡ್ ಮಾಡಿ ಮಾಡಬೇಕು.
ಈಗ ಮಾಡಿ
ಕ್ವಾರ್ಟರ್ಲಿ ಮಾಡಿದ್ದು 2 ಇಯರ್ಸ್ ನೀವು ಏನಿದೆ ಅಷ್ಟನ್ನೇ ಪೇ ಮಾಡೋದು. ಅಲ್ಲ ಅಲ್ಲೂ ನೀವೀಗ ಫೆಬ್ರವರಿ 28 ಅಮೌಂಟ್ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಅಲ್ಲ 16 ಮಾಡ್ತಿದ್ವಿ. ಈಗ ಈ ಮಂತ್ ಫೆಬ್ರವರಿ ಬರೀ 28 ಡೇಸ್ ಇದ್ದರೆ ನಿಮಗೆ ಆ ಕ್ವಾರ್ಟರ್ ಅಮೌಂಟ್ ಕಡಿಮೆ ಆಗುತ್ತೆ. ನೆಕ್ಸ್ಟ್ ಆ ಥರ ನಂಬರ್ ಆಫ್ ಡೇಸೇ ಮಾಡ್ತಿಲ್ಲ.
वेट से मैंने
ಫೆಬ್ರವರಿ 28 ಡೇಸ್ ಮಾರ್ಚ್ 31 ಈ ಫೆಬ್ರವರಿ ಮಾರ್ಚ್ ಏಪ್ರಿಲ್ಗೆ 28 ಪ್ಲಸ್ 31 ಪ್ಲಸ್ 30 ಡೇಸ್ ಅಂತ ತಗೊಂಡು ಮಾಡ್ತಿಲ್ಲ. ಬೇಡ, ನಮ್ಮ ಟರ್ಮ್ಸ್ ಆ್ಯಂಡ್ ಕಂಡೀಷನ್ ಕ್ವಾರ್ಟರ್ಲಿ ಪೇಮೆಂಟ್ ಅಂತಿದೆ. ನೀವು ಕ್ವಾರ್ಟರ್ಲಿಂದ ಬಿಲ್ ಮಾಡಿ ಡಿವೈಡೆಡ್ ಬೈ 8 ಮಾಡಿ ಡಿವೈಡೆಡ್ ಬೈ 8 ಮಾಡಿ ಒಂದು ಕ್ವಾರ್ಟರ್ಗೆ ಇಷ್ಟು ಅಂತ ಮಾಡಿ ಎಲ್ಲ ಕ್ವಾರ್ಟರ್ನಲ್ಲಿ ಈಕ್ವಲ್ ಪೇಮೆಂಟ್ ಬರುತ್ತೆ. ನೀವು ನಂಬರ್ ಆಫ್ ಡೇಸ್ ಮಾಡಿದ್ರೆ ಒಂದು ತಿಂಗಳ ಅಲ್ಲೂ
ఓకే వస్తుంది నా దగ్గర. वेट से मैंने ఓకే వస్తుంది నా దగ్గర. वेट से मैंने వస్తుంది నా దగ్గర. సార్ నన్ను वेट से मैंने వస్తుంది నా దగ్గర. సార్ నన్ను Anu sir? Anu sir?
Yes, Kumar. Kumar?
Ah, yes sir.
Yes, bolo bolo.
Ah, sir, this live I started. Actually, there is a some issue in Vasala conference hall.
Okay.
So for that purpose, I have started live also.
Okay.
So we will put some page that live will that lecture will starts at 3.
Okay. If you can do that, then do that. Yes.
Yeah, that I am doing.
Yeah. At exactly 3.
Sir, no.
Okay. एक चीज बस चेक कर सकते हैं क्या उसमें साउंड भी आ रहा है या नहीं देखो तो
हाँ, where sir? Anu
इन
sir?
YouTube
YouTube.
preview
Anu sir?
are you able to listen to the sound
Some voice
what we are speaking.
Oh, this yes
Voice-
sir. Voice also is coming, but some
yes bolo bolo
delay. Some delay is there. Started actually.
no, delay
There
of
is
around 1 minute will be there, that is okay.
yes. I am hearing two voices. I don't know. I didn't get what exactly it is. Then now I am getting. So YouTube also it started here.
Okay, nice.
No sound also there is no issue. So live I have started here. You can go ahead. No sir, I will go to the hostel conference and I will check.
Yeah, go live and then schedule it at 3 o'clock exact, then
No, I think it is already started live. Here I am able to see also.
नहीं, but that should not mean कि अभी हम लोग जो बात कर रहे हो सब चला जाए.
Yes, but currently no users. Only one concurrent users. That also now 0.
नहीं, उसमें शेड्यूल भी होता होगा शायद या नहीं.
एक बार एंड स्ट्रीम करने तो I don't know whether we can start it
नहीं,
again or not.
नहीं, don't end the stream. Okay,
Okay.
I think we are already live. Fine. Okay.
We can mute it, sir. No issue. I think from our side nothing is required.
All right. Okay. नहीं इसलिए मैं पूछ रहा हूँ क्योंकि अभी आई थिंक यू नीड टू बी देयर एट लीस्ट 3 o'clock because we want to see if that speaker's presentation will be visible to YouTube users or not.
Yes.
उसका
One second,
layout
I will
and
share
all
the
that we have
screen
to-
for time being.
Yeah.
For this lecture starts at something.
Okay. Excellent. One second, I'll just call the speaker and I'll ask him to call.
Sir, can you are you getting this lecture starts at 15 hours?
Yeah.
Stay
Yes,
tuned here.
Yes. Okay.
So I am going on mute.
Okay. But one second, you need to remove your presentation ना. If that happens, एक काम करो, मैं यहाँ से present
You
करता
are the admin, right?
हूँ. No, there nobody is admin.
Oh,
नहीं, don't do that. Cut it out.
okay. I will be here only, no issue.
You remove your हाँ, actually best रहेगा तुम वहीं रहो.
Remove करूँ?
हाँ, presentation remove कर दो अभी.
Okay.
एक सेकंड, अभी मैं डॉक्टर को कॉल कर रहा हूँ.
ಏನಿಲ್ಲ ಸರ್ ಇದಿದೆ.
Yes, welcome, Dr. Vageesh.
Yeah, thank you. Here?
ಕೊಡ್ತೇನೆ ಸರ್. ನಾವು ಕಾಪಿ ಮಾಡ್ತೀವಿ.
Okay.
Namaste.
Background ಬೇರೆ ಮಾಡ್ಬೋದಾ?
ಹಾಂ ಬಂದೆ ಬನ್ನಿ. ಜಸ್ಟ್ ಈ ಸ್ಕ್ರೀನೇ ಬಂದ್ಬಿಡುತ್ತೆ ಸರ್.
Okay.
ಈ ಸೈಡಲ್ಲಿ ಇಲ್ಲಿ ಓಪನ್ ಮಾಡಿ.
This is going to be in SSC conference hall only.
ಯಾವ ಸರ್ ಇದೆ?
ಇದೆ.
ಡೆಸ್ಕ್ಟಾಪ್ ಬಂದಿಲ್ಲ?
Desktop.
Possible now, sir.
ಆಯ್ತು ಬನ್ನಿ.
Okay. I think Kumar is working on that. I think Kumar has gone to Hoysala.
ಓಪನ್ ಆಗಿದೆ ಸರ್.
He's setting it up. I think he's setting it up, but I'm not sure. Can you just call?
ಓಪನ್ ಆಗಿದೆ.
ಇದನ್ನ ಇದು ಹಾಕ್ಬಿಡಿ. ಇದನ್ನ ಹಾಕ್ಬಿಡಿ. ಇದು ಸ್ಕ್ರೀನ್ ಇದು.
Yes, I'm able to see your presentation.
Can you see my presentation now? ಇದೆಯಾ?
Yes, that's affirmative. I'm able to see your presentation.
Okay. This is okay?
Yes, fine. It is visible. Thank you.
Okay. Am I visible in the panel?
Yes, you are visible now. Yes, doctor, you are visible. You can come a bit closer to the camera.
This is okay?
Yeah, this is fine. This is better, much better. Yes, sir.
This is okay, right?
Yes, sir, this is okay.
In the panel, like, can I change the background? Actually, it is some technology.
Yeah, you can do that. Yes,
Yeah,
yes,
how?
you can do that. You can go to settings, to the right
Just
top
a second.
settings.
Just a second. Guide me for that. Be my illa things.
No, outside of your, are you in your presentation? You can come back to your blue jeans wherever you are using. You might be using your browser or an app. You need to go to your web browser.
App.
Okay, app. Okay, fine. You're sharing your screen, right? You can just select one of these, and to the right, you can do stop sharing for 1 minute. What you can do first is you can stop sharing. Yeah, yes. Now you have, I'm no longer able to see your presentation. That's okay. Now on the top right of your browser, can you see settings? Yeah. In the settings, you will be able to see your camera feed, and just bottom
Virtual
to that,
background, right?
choose virtual background. Yes.
Super, super.
You can try that. Yes.
Tell me something.
What happened, sir? Sir, what happened?
Welcome to all our viewers on YouTube Live as well as offline in MCF campus. So he is able to. Yeah, as part of Swachhata Pakhwada 2022 celebrations, we have a webinar. We have two webinars. The first webinar is scheduled today, so we are here. We have joined here for a webinar on health and sanitation in view of COVID-19 by Dr. Vageesh from SSM Hospital Hassan. So, like we all have been facing a lot of trouble because of this COVID pandemic. So I'll just introduce you to the speaker. So I'm getting it. So Dr. Vageesh is the son of G.S. Bhatt, a retired Sanskrit professor, and Anusuya G. Bhatt, a homemaker. He has scored 5th and 7th rank at state level in 10th and 12th standards. He has completed his MBBS from Bangalore, MS from Odisha, and MCH in gastroenterology, surgery, and liver transplant from the prestigious GB Pant Hospital of Delhi. He is a fellow of Diplomat National Board, fellow of International College of Surgeons, fellow of American College of Surgeons. He is ex-consultant at AIMS Delhi, SGPG IMS Lucknow. Presently, he is working as a senior surgical gastroenterologist at SSM Hospital Hassan, Karnataka. He has many affiliations, like member of many prestigious international surgical
Yes, sir. Yes, sir.
associations,
Just.
president of Indian Medical Association Hassan. He has won many awards like Infosys Best Doctors Award, Presidential Appreciation Award, Torrent Young GI Surgeon Award, numerous publications in international and national journals, delivered many guest lectures in many national and international forums, and he has special interest in linguistics and Sanskrit literature. So we are really thrilled to have you here for this lecture. Thank you so much for coming live. And so over to you, Dr. Vageesh. Thank you.
Dr. Vageesh, good afternoon. So I am SP Chennai Director NCF. With me, I have both my deputy directors here, Mr. S.N. Satyanarayana and Mr. M.N. Subramanian. I think, I don't know whether you are getting our video, you are not getting us.
Yeah, only he is able to see the voice.
That's all.
Hear the voice. Yes.
Yes, I heard a lot about you in my close circles of my friend circle. Many of my friends there, we have common friends. Dr. Nagesh, Vishwanath, but like that, many people are there. So we have common friends. I think sometime later, I think I will meet you in person also.
Pleasure, sir.
To meet you.
Thank you, sir. Thanks, sir.
Over to you.
Good afternoon, everyone. So, first of all, I profoundly thank the MCF and organization and not a new virus at all. It is not a COVID आ गया तो अभी ये पूरा नया आ गया है ऐसा तो कुछ है ही नहीं है. Corona virus सदियों से है. It is there with us for a long time. But the mode of infectivity, how it spreads, how it comes, it's an interesting story behind. To know that, let us classify it into highly pathogenic coronaviruses and low pathogenic coronaviruses. Basically, you need a vector in between. Our first host is a person who suffers, and then the source will be there. From here to here, you need a vector for the transmission. So there are many other things which will happen during the infectivity period also. In highly pathogenic coronavirus, we can see we have suffered in 2003 SARS-CoV-1, we can call it as, that is severe acute respiratory syndrome 1, which had taken lakhs together people. And in 2012, we came across MERS COVID virus, that is Middle East respiratory syndrome virus, which lasted for a small period of time and it didn't become much more dangerous pandemic as we are experiencing today. And then in 2019, of course, Corona, it is SARS. Most of the coronaviruses, primary host is, or the reservoir is bat. You see, all of us know that fruit-eating bats in most of the places where they live in caves are the most important primary host. But the intermediate hosts were different in different organisms. Like for SARS-CoV-1, it was some wild cats. And 2012 MERS, it was, that is for MERS COVID virus, it was what we can clearly see, it was a camel. And then 2019, pangolin was considered to be one of the intermediate hosts. Ultimately, who's the host? Sufferers are we. So, just because of the bad sanitation, once again, we landed up in this situation. What is it? Our eating habits. What human did? Humans started eating everything that moves, because this is what has been taught in, I think this is the standard dialogue they say in US Army. Because in Army, you need to survive. That's ultimately the most important thing. So what do you eat? Everything that moves is edible. That is the primary thing they give it. So similarly, probably this is just an analogy, I'm just giving it. Probably in some places geographically on this world, people are crazy to eat whatever that moves. And probably our genetic material exchange are taking this to this kind of pathetic situations. And then comes low pathogenic coronaviruses of different variations and varieties, what we can see on the panel. see how the pathogenesis, how it is happening actually, how it has come, coronavirus. We know that because primary host is a bat. And then how it got transferred into the human being then? See, SARS coronavirus entered into primary hosts and even snake was also one of the primary hosts that was considered. Human being eating nicely the bats and snakes in some parts of this world are the intermediate. They just transfer the diseases, and then human, once he gets into the disease mode, of course, it is a droplet in nasopharyngeal airways through which he affects, and of course, it becomes a very fastly spreading like a wildfire. And what we are experiencing today, we are here in the scene. Next. What are the symptoms? Of course, we know about the pathogenesis. What are the organisms causing coronavirus? Coronavirus is not new. COVID-19, what we are suffering now, its structure, all these things are over now. How does it act in a human being? We, in and day out, in the first wave, second wave, we came to know and we heard a lot about these things that, अरे हमारा पेशेंट तो एक वेंटिलेटर में है, लोग ऐसे मर रहे हैं, रोड्स में मर रहे हैं. तो कर क्या रहा है ये वायरस? What is it doing? How it is destroying, or how is it affecting the health of a human being? First, coronavirus, basically we know about the structure, at least outer envelope, capsid and inner genetic material. It just comes and affect the respiratory system of the human being. Respiratory system can be classified into upper and lower respiratory system. Upper is a larger airways, that is maybe trachea and primary and secondary bronchi, and then lower airway are nothing but lungs. Lungs, basic unit, we know that basic units in each structure in our body. For example, if you mention about the brain, it is a neuron. If you mention about the kidney, it is a nephron. If you mention about the liver, it is a islet cell. Similarly, in a lung, we have got alveoli. They are all the most important basic cell structures. These viruses, once they cross from the upper airway, they just go and attack the lower airway at the level of the alveoli, where there are some types of cells called type 2 pneumocytes, where the virus will replicate and enter into the blood system. Once they enter into the blood system, till that period, it is normal. It is just like any other virus. Then comes the host reactivity. Here where this is the point where the difference between different spectra of the diseases we can see. On the one side, we see a positive patient who is roaming around like a hero. And the other side, we see a young chap who is a very well fitness freak, who is on a ventilator struggling for his breath within a period of around 4 days. Doesn't it stimulate our brain to think about what is going on, why this is spreading so fast? If the same disease is causing nothing in a person, how can it cause such a severe disease in another person? This is the step where the transfer of the virus from the alveoli into the blood, this is where the game starts. 1 out of 10 will react extremely. इसको easily बताना है तो देख लो, अगर आप घर में आप कोई एक चोर आ गया, in some houses people will say ठीक है next time से चोरी मत करना, that's all, they will send out. In some houses they will kill, reaction will be extremes. The same thing is, some people will like throw away all available immunological mechanisms into set the virus out. This is called cytokine storm. That is nothing but our body is killing ourselves. So this cytokine storm is nothing but an antibody reaction which is in an excess, it is in a stormy way, which is actually not needed to handle the virus. And ultimately, this kind of cytokine storm will kill our blood cells, will kill our neurons, will kill our kidney nephrons, and may kill our islet cells in the lungs, in the liver, and ultimately it causes multi-organ dysfunction and patient dies. But the severity and the time of affecting is different in different people. That is why the whole spectra of clinical presentation exists. Then comes symptoms. Okay, this is the pathology. We understood that what is that does. But how the patient will present and how long he can Why we are stressing so much about all these things? But why? Because this game is not over yet. This is a long fought battle. We need to understand about the disease. What is the importance of sanitation? What is its base? How does it produce the symptoms? What are its structure? It is our basic things to understand. That's why we are all stressing upon all these things. So we know that some patients may be asymptomatic and some patients may present with fever, cough, fatigue, loss of taste and smell, diarrhea, headache, sore throat, aches and pains, and conjunctivitis also. Then of course there is many other types of symptoms which present. And then in olden days about few infective diseases, especially about the tuberculosis and even about the malaria, there used to be a funny quotes in the medical schools usually. So tuberculosis, they used to say in the sense tuberculosis can present like anything except pregnancy. This was the importance about to highlight about the importance of infective diseases. This was the thing. And next, health and sanitation during COVID-19. So till now we have understood the basic concepts about the in the topic, that is health. We spoke about health, importance of health, about the sanitation, and then about the basics about COVID-19. Now we will try to correlate things and what are the importance of health and sanitation during this period, what was our experience, and what is the message to carry forward, and what are the learning points we have noted upon. Fine. This is the first point what we have noted. Health is not valued till sickness comes. We cannot put any other situation than COVID-19 to explain these things. So, where we have moved from, if someone asks me, what was the journey of COVID-19 for you as a doctor when you view outside? Because there are two perspectives. One is people who are sitting outside the hospital, and one people who are sitting inside the hospital, who are working inside. For a people who are working inside, from our doctor's perspective, we can say that this world has witnessed as three phases. One is my extreme light upper corner, that is global pandemic alarm of COVID-19, which was given during the December of 2019, crossing across, markets falling, there is a huge loss, social instability, all kinds of problems, to a stage where we almost have a solution, that we have got a vaccine. Especially about my great country, I can proudly say that we have vaccinated to the extent that in every corner of this country, for healthcare workers or the frontline warriors, free vaccination has been given. Even vaccination are at the throwaway prices. Look at, there are few places where across the world people are striving and very struggling, facing a lot of problems to have an access to the vaccine. Here is a country which is filled up with 140 plus crore population, where we find so many people, but still we have fought it. I will proudly say that this country has fought this disease extremely well, and of course this has to be given. The talk may not be political, or the talk may not be having an angle, but definitely the leadership has to be appreciated, and the commitment to this society and the kind of work what they have done, it is simply, there is no words to explain about it. I am really proud to say that this country has fought this pandemic very well, and still we are running across in matters of whatever economy, it may be in terms of vaccination or any other problems. We are facing it right now. We have handled it very well. If you look into the global toll about the mortality rates, it has been estimated that around 5.5 million people have lost life globally. This was it was around January 13, 2022 data, maybe around 30 days old data, 25 days old data, which says around 5.5 million people have lost their life. Confirmed it. Of course, it is an iceberg phenomena which comes into picture, where there are many uncounted deaths which have happened. Like it may be 3 times or 4 times. Many models have calculated that maybe around 4 or 5 times people might have lost their life. Whatever numbers may be, even this is a global toll. If we talk about the Indian scenario, comparing, once again, I just want to highlight this country with a population of 140 plus crores, when the disease came in and initial days of understanding the disease, when the panics was set in, we thought crores of people will lose life based upon simple models. But ultimately today we are here, definitely compared to these things, very less number of population have lost their life. It is not a greatness, but ultimately we have to say, comparing to the data of the global things, India has done really, really well and maintained well. And of course, the game is not yet over. We need to keep fighting about this. This is the whole purpose why we are here, to discuss about this and to know about the importance of this disease and how to go about it. So we know about the disease, pathology, symptoms, how, and all these things. So now comes the aspect of total management, and then how when a person gets infected, or when the scenario came, how did you manage? We used as a doc, because for a patient or for a common man, it is like, it is very difficult to understand what went on from the medical side. There are a lot of things. That's why this heading, COVID-19 diagnosis and management, a comprehensive review. We came across different aspects, like when the disease came, the investigating the disease, in the sense whether he is positive hai or negative hai, usko pata karna itself was a very challenge, because it's a new thing. So there we struggled, we stood ahead, and then we came across many tests, which we have a rapid test to diagnose. And then when the diagnosis is made, next we also have radiological diagnosis like CT scan, X-rays, all these things we used. And then therapy, right from minimum medication, tablets, to ultimately do many IV drug plasma therapies. We went into most advanced treatment therapies during the COVID-19. And of course, oxygen was a big issue. Ventilators were big issues. Every aspect in this disease was a big issue from the medical side, because it is a new thing, and then we are never taught in the medical schools how to manage this kind of a huge pandemics, which were all there in the previous books, but no generation had experienced this. And ultimately, the most important part is prevention of this disease, because the story is not yet over, it is still continuing. What are the types of tests we have? We have PCR tests, we have rapid antigen tests, and one side we have antibody testing. We know that that is rapid antigen test, is given in minutes. A PCR test will take maybe around 12 hours to 24 hours for the reporting. When the queue is more, it has taken even weeks together. And antibody testing, once the vaccination given, or once the infectivity was there, after a period of around 3-4 months, we do these tests to find out what is the level of protective antibodies. Even though they don't give us the clear picture about the total protective levels, but still antibody level, we don't have a clear level 1 evidence to say that they are very protective, and all the antibodies what we have are protective antibodies. But still, antibody testing exists. So what were the ones about the testing? Along with that, we developed few imaging features like X-ray. When the disease becomes severe, or even the early stages, we used to say, in my left panel, you could see a patient who is suffering from, who was an asymptomatic patient, who suddenly, which was not, whose X-ray was normal. Within 3-4 days, you can see the marked one where we have highlighted. There are white patchy areas which are pneumonatic patches. That means, what is pneumonia? Pneumonia is nothing but, see, lung is made up of alveolar, small balloon kind of a thing, which has to expand during the inspiration and respiration, which purifies our blood, which comes from the heart. If the alveoli are not working, that is dead. It is just become solid or rocky hard. So it is nothing but consolidation or pneumonatic changes. Then what happens? Air cannot enter, patient cannot breathe, his pulse, BP, saturation level comes down, other systems will be affected. CT, you might have seen, it was becoming, in the previous days, it was becoming so common, because during our medical schools, we used to discuss among doctors that what is the score, because we have scoring system for many other diseases also. But it has become so common that we used to hear this even when a common man walks in and, sir, CORAD score nalakide, what to do? CORAD score is 17, what to do? Everyone became doctors and everyone knew about all these things actually. So we do have classification systems for this, right from CORAD 1 to CORAD 5, and even sometimes CORAD 6 in different classification, where the affected lung part will be quantified. If it is lower, if it is smaller amount is affected, it is CORAD 1, and if it is bilateral maximum, it progresses to CORAD 6. Treatment part, what were the options we had for treating this disease? Of course, we know that this is a very famous drug. In the beginning we started with, because none of us know what will act. Tried with azithromycin, we tried with ivermectins, steroids in the form of dexamethasone was given, whatnot. We tried almost all our full of pharmacology. Sometimes which is not acting, we shifted over to few important molecules like remdesivir and then tocilizumab. These were the most advanced, costly drugs. People very easily say that sumne remdesivir kotbitru, sumne tocilizumab kotbitru. Nobody has given. None of us, none of the doctor has given. And I can assure you from my side that remdesivir has saved many of the people's lives. And then in the ICU itself, for a severe disease, it acted as a magic drug for many of the people. Even though rationale behind this was confusing in the beginning, but definitely this drug has saved people. And then of course, convalescent plasma was tried. Why this happens in medical field? When the disease is new, you need to, for any disease, you will have a fixed protocol of treatment. But what is happening here? There is a new disease right in front of you. None of the medications act, and none of us know what are the things to be done right from the investigation to the treatment panel. So convalescent plasma was tried. We don't have any evidence also how it acts. And then of course, we ultimately HCQ was used in the beginning. None of the drugs have had a level 1 evidence to say that it acted, but definitely few of the drugs have saved life, and they have helped to take the seriously affected people out of the ICUs. So regarding the one more component of the treatment, that is breathing aid in COVID-19. One is, we know that there was an oxygen therapy one side, ventilator one side, and CPAP device one side. What are these three things? And because many people were used to ask me, sir, what is an ICU? What is the ventilator? What does they do? They think a person goes on a ventilator, that means he will never come back on a one side. Another side, if he goes on a ventilator, that means it's extremely serious and he's almost dead. And even some people say that dead people are kept on a ventilator. Please try to understand, nothing of that sorts were done in any corner of this world. And serious efforts were made from every personnel in the medical field to save lives actually. So oxygen therapy, we know that giving the oxygen, we had a lot of methodologies. Suppose what we use is a simple mask oxygen we have seen, nasal prongs through two things we have seen, these things, and then little higher, when the quantity is higher which is required, then we will see the patient who is going on to the BiPAP machine or on a ventilator, because delivery mode is different. Ventilator is a device which will help for an individual to give an artificial breaths. Then comes to understand the importance of oxygen. All of us know that because during the second wave, we had seen a chaos across the country where, across the world, in fact, where there was a great deficiency of the oxygen. Why it happens? Because medical oxygen, what we use for humans, is not storable, in the sense, even if it is stored, it is not stored in such a huge quantity. None of us in this generation had faced where such a great amount of oxygen was necessary. So conversion from liquid oxygen to the gaseous form of oxygen is a very costly effect, and it has to be done in a short span of time. The logistics with which they have worked, because oxygen, if you see, it is highly utilized in steel plants basically. The way in which the top authorities have thought about it, the logistics which were maintained to transfer the oxygen facilities from industrial areas into the needed medical care was simply amazing, and wholeheartedly we have to appreciate this effect, because human brain works in that way. You need to appreciate whatever may be the thing. If somebody is doing good, we need to appreciate, because positive feedback is essential to carry on the same positive things. That is the reason why in Kannada we say gunakke matsara veke. It is very important actually. If somebody is doing good job, we need to appreciate to carry it forward. Then comes prevention part. This is the most important part in terms of public health. If we prevent a disease, nothing like that. Why to suffer from it? So we all know that this SMS policy became a very huge and hit, and then be very famous also. Sanitization, using mask, and maintaining a social distance. What do sanitizers do basically? See, when the bacteria or pathogenic viruses are there, suppose, on the hands, when we use a sanitizer, which may be in alcohol based, inactivation of the bacteria by lipid membrane lysis and release of the intracellular content, it just ruptures. Bacteria cannot act at all. What happens on a virus? Inactivation of the virus, same in the lipid membrane lysis, envelope itself and capsid itself opens up. Genetic material, when it comes out, it totally get lysed. It cannot survive. So sanitizer comes into picture. These are all very important messages, because we still have to do it for a longer time. We don't know till what time. And then comes masks. In the early period, we know that right from the cloth mask up to in the beginning, just like any other confusion, this was also a big confusion, whether whether we have to use a mask or not to use a mask, whether we have to use a normal mask, cloth mask, or to use surgical mask, or for a N95 mask. Everything was a chaos in the beginning, but slowly pictures were becoming clear. We have different types of masks, as I mentioned, right from the cloth mask up to the N95 mask. See, basically, mask has to be used to mask the spread of the disease. People take it in other way around. Why we mask it? To avoid the disease. No, it is not in that way. It is based on the, probably I may say, it is based on the premise that sarve jana sukhino bhavantu. That is, I will not, if I cannot help someone, I will not harm them at least. It is basically designed in a premise that it will avoid, if you are a positive and if you are asymptomatic, if you are not tested, take it for granted that you are harboring the virus or any other pathogen. If you use mask, you will not spread. The spreading rate will become less, because aerosol molecular size will become lesser, as the picture is showing here. When we don't use a mask, the size will be bigger, and when we throw it, the liquid droplets will become very, very small. This picture, most of you might have come across in WhatsApp, and this is what happens. See, when let us take an infected person and I am a normal person. When both are 1 meter apart and both the people are not using the mask, the level of protection is not there at all. If an unaffected person is using the mask and infected, it is low. And if infected person is using a mask and the normal person is not using, it is moderate. If the both use, it is like high protection levels will be there. That is why even now we have almost level 2 evidence that mask will be helpful, and this trend has to continue for some more time. Social distancing. It started with 8 meters actually. Now we have this one that around 2 meters is sufficient, based on the observations that the droplets particle, how much they travel. So social distancing has to be maintained around 2 meters. And then comes, in the same prevention part, we have a big weapon called vaccinations. We know that there are different vaccines, and just to put some light onto the vaccines, we have a whole virus vaccine, we have an RNA vaccine, we have a protein vaccine, and viral vector vaccines. The whole virus vaccine is, we will attenuate the vaccine and bring their power down, and then we'll directly introduce into the human body. When it goes in, it in a smaller quantities, it produces a lot of antibodies. It will keep it ready. Next time it comes, memory will be there. It will fight against. For example, we have Sinovac vaccine, not commonly used. RNA vaccine is RNA particle will be taken and will be introduced. We have Pfizer, Moderna, all these things. And protein vaccine, subparticles of this will be taken and then will be introduced. And viral vector portions will be taken. For example, we have Sputnik and Janssen, AstraZeneca's vaccine, all these things. So these are different types of vaccines which will act. What is a vaccine basically? It just goes and induces our immune system and keep it ready to fight when the real disease comes. It is just like a rehearsal, that's it. Once again, the proud moment for India. Every segment of this saga of COVID-19 management, we come across at every moment we have come across, right from the diagnostics, right from the treatment, right from oxygen management, up to the vaccination. This is the biggest success what India has seen. We have indigenous 2 vaccines which was ready. The idea was sown at the time when the disease was only 10 days old. First we noticed in January 18, but it was declared on March 2020, March 24th. But after that, within a span of 2 months, the idea of preparation of vaccine was prepared, and we had it in around December 2020. The trial of Covishield and Covaxin were there and widely available, and almost 70 to 80% of population has completed their vaccination. It is a proud moment for India. And of course, we have Covaxin and Covishield. Covaxin acts through the same as inactivated vector portion, and then Covishield and Sputnik acts through the viral vector part activations. So this is how we managed COVID-19, and these are all the importance of sanitation and health about the COVID-19. Now, to be on a lighter note, or we may say about the maybe the domain expertise exchange, I would say, space and COVID-19. During the COVID-19, what the space technology of the world and this country did, what you people were doing during this time, wonderful efforts were done. These are the pictures from NASA which shows COVID-19 affected areas depending upon the numbers, and this one. This picture gives the somewhere in the airport pictures of US in somewhere, where you could see before the one side there is a picture. In my left panel you could see the airport areas which were highly traffic oriented areas in 2018, but on the right panel you could see same areas because of the lockdown effect and there was no travel across the world. The temperature markings were very low and these hotspots are not there at all. Where will we get all these beautiful information? This is definitely because of the space technology. Of course, this statement, recently I got to know about this, which was told by none other than Dr. K. Sivan. There is a feeling that very little happened in ISRO during 21. That feeling is primarily due to less number of launches. This man says this after launching 2 successful PSLV machines in 2000 in the last year. Hats off to you people, continuing with the scientific innovation, continuing with the continuous efforts to put our great country onto the highest levels. Simply speechless. Definitely we have all the shortly we will be successfully seeing the Chandrayaan. During these tough times also, this country has fought so well in every corner of our country, and then even every aspects. And we are really, once again, this is a proud moment. Even in those dull areas, people have done 2 successful PSLV missions. I'm really proud of this. So ultimately, I would say we can beat it together, this COVID-19, only if we follow all these things, all these protocols, safety measures, and stick to the basics. Let's fight, let's continue the fight, and let's put all our efforts to take out this whatever devil out of this world. Thank you. Thanks a lot. Sir, I think any questions are there. I'm ready to take it.
Yes, yes. So just give me a moment. I'll just check on my YouTube feed. If there are any questions, just give me a moment. Meanwhile, just I would like to thank Dr. Vageesh very much for a very elaborate and very nice lecture about COVID-19. He started from Charaka Samhita to our vaccination, like it was like very nice and also thoughtful analogy about the structure of the virus and with the rocket. And also, we are really grateful that you mentioned achievements of ISRO also. And we also salute all the doctors and all the healthcare workers for doing a great job during this such a difficult time of COVID pandemic. Just give us a moment. We'll just consolidate all the questions and we'll ask them.
Sure, sir.
Was very good. In fact, I just want to add during this struggle to face COVID-19.
Yes, sir.
I think ISRO also has joined hands with the nation. We, in fact, gave all our oxygen what was available with us in two of our centers, especially Sriharikota from where the and from IPRC from where the rocket engines are tested. All our stock what we had oxygen, we gave it to liquid oxygen. So we gave to the health department. So we stopped all our launches during that period because the liquid oxygen was not available, which is used for the cryogenic engines. That is one thing. And second thing is our
Yes,
Vikram
sir.
Sarabhai Space Center at Trivandrum. They designed the oxygen concentrator also, and that was yeah. So that's what our scientists, what best we could do at the time of pandemic. I think they have raised to the occasion, and we have done that. In fact, there were so many questions raised during the pandemic. China and other countries, they are launching so many satellites. But India, the way the oxygen demand was so much, and that much people were affected and all. So that was the period where we were pressed to give this whatever oxygen, liquid oxygen we had to the facing this COVID treatment for that. Some questions.
Have any questions on
Sir, I just want to ask one question. See, there were rumors in the even medical field also, India also, they were telling that it is not a natural virus, it is an artificial virus like that. How do you subscribe to this theory, or is there any other thing is there behind this?
Yes, sir. Actually,
War only it is there now. So is it a form of war? That is what is the people asking.
yes, sir. Actually, I was just mentioning about all these things during my presentation. Actually, it is too early to say whether it is a component which has been introduced into this world as a part of biowar, or is it just the one of the organism which has escaped out of the trial laboratories, or is it a natural mutations that has occurred and then we are into such scenario? All these three scenarios are possible, and only the time will say, and the investigation agencies will can give us the final report. But of course, as I was mentioning, these viruses can definitely be used as a weapon for the biowar, no doubt about it. But COVID-19, is it a biowar weapon? We really don't know. We don't have an evidence for this.
Thank you. And one more thing. Yeah, and the Omicron, whatever now we are seeing in the wave, third wave, many people say that it is not really related to COVID-19. Is it true? Because too much mutation, so many mutations are there. We can see after some 20 or 30 mutations, only you can see Omicron like that. I saw a report, but a lot of such things are there. It's not very clear to many of us.
Yeah, of course. Within the coronavirus, we have seen many variants because of the mutations of the genetic material, right? From alpha to delta, now it is coming on to the Omicron. It is not true that it is like it is. It's not a non-coronavirus, but definitely it is a part of the coronavirus Omicron portion. And of course, the infectivity levels is high. The spread is very fast, but the severity of the disease is less as we are witnessing. And so the